Good morning, ladies and gentlemen. Today I'm speaking on the advances in teleradiology. What is teleradiology? Teleradiology is actually part of telemedicine to empower the healthcare services and provide diagnostic and imaging services to the remote areas. In teleradiology, actually we acquire the images at one place and transmit these radiographic images to other place for interpretation. There are three basic components of teleradiology: an image sending stations where the images are acquired, a transmission network to transmit these images, and a receiving image review station where the images are received for the interpretation or reporting. The image sending station requires image digitizer, which converts the images into digital format, and the network interface device, which is modem, which converts the digital data into electrical impulses and data set along the transmission network. The ideal sending station should have very high resolution, little or no compression, very high transmission speeds. The sending station specifications are image resolution is very important. Pixel should be at least 512 into 512. Then image compression. The aim of image compression is for the storage and transmission of the large number of data and to maintain the sharp edges and general texture of the for higher image quality. There are two types of compression: lossless or reversible compression. There is no loss of information. And the lossy or irreversible compression, there is the insignificant information discarded during the compression in the lossy compression. The benefits of compression are to reduce the storage requirement, transmission cost, and the time of the transmission. These are the few MR images of brain. The topmost image is uncompressed original image, and the lower 8 images are showing the different level of compression. You can see there is no appreciable change in the quality of images. So this graph depicts that if good lossy compression is done, there is no observable or appreciable difference from the lossless compression. Now the transmission network. The transmission network requires a wire or fiber optics, microwave, and the transmission speed and cost closely related to the transmission mode. There are two methods provide the secure communication channels with IP-based DICOM image communication protocols. And this Internet Protocol version 6 is a new version for the higher speed Internet functionality, overcoming the Internet Protocol version 4. In data transmission, there are three critical issues for the development of a teleradiology system: the data privacy, authenticity, and integrity. Privacy refers to the denying the access of information to the unauthorized individuals. Authenticity refers to the validating the source of a message and ensuring that it was transmitted by a properly identified sender. Integrity refers to the assurance that the data were not modified accidentally or deliberately. Then the receiving image review station. It requires network interface modem, PC with storage medium, 1 or 2 monitors, optional printer. This is the flow chart how we transmit the images from the original site, that is sending site, and then there is encryption of the data, and through this secure transmission channel, the data sent to the receiving site or the reporting site. This is the teleradiology workflow, which comprises of remote centers, hospital land, and the hospital PACS system, and then the reporting can be done through a remote area through this teleradiology. The teleimmersion. Teleimmersion is important to make patient-specific data quickly available, usable to many specialists at different sites. In this teleimmersion, we integrate the audio and video conferencing with collaborative virtual reality images, that is the volume renders images and 3D images. The teleimmersive radiological system has been developed for remote consultation, surgical pre-planning, post-operative evaluation, and education. The teleimmersive devices are personal augmented reality immersive system, that is PERIS, configurable wall, C-wall, physician's personal virtual reality display, and immerser desk. These are the different devices used for this creating the virtual images. So the surgeon or physician can see all the volume render 3D images and plan accordingly the surgery. The PACS is a picture archiving and communication system. It typically consists of the archive device, diagnostic wing stations, the monitors, clinical reviewer physicians, servers to distribute the image throughout the hospital network. PACS extended to manage all medical images acquired within the hospital. Beyond the radiology, it can be used to acquire the acquire and store the scanned documents, prescriptions, and patient questionnaire, and all the investigations and imaging data. This image showing the documentation of venous insufficiency in PACS system. Here the photographic images of the patient, a lady having the venous insufficiency with varicose veins. You can add also the clinical information and all the other investigation into the PACS. This is the PACS workflow. There is first registration, scheduling of the patient, then the examination, all the investigations, imaging, then review and reporting of all the investigations, and then all the data, images, and reports sent to the referring doctor. The other scopes of teleradiology in neurological services, in managing and processing obstetrical and gynecological data, in army and disaster situations, in dental implantation, robotic teleechocardiography, in interventional radiology procedures. The MMS service is very helpful in neurosurgical department. In emergency case, the MMS service is very readily available, simple and cost-effective method for the transmission of scan images. The data can be sent through the mobile MMS to the concerned doctor through the mobile phone, and it reduces the need for hospital callback. The ultrasound image transmission can also be done through the camera phones from the remote locations like disaster scenes, battlefields, cruise ships, or air ambulances. The requirement is just to have access to a network on which the camera phone can transmit the data. This image, you can see the soldier carrying the ultrasound over his shoulder. The main goal of this teleradiology here is evaluate hundreds of blunt trauma victims and to look for bleeding in the abdomen, perhaps signs of lung collapse in thorax, and transmit these images through the camera phone, and the nearest trauma hospital can then identify the victims who need urgent treatment. In Army, the greatest medical contributions is for the recovery of a wounded soldier. It can tell you immediately which patient to attend first and transfer first. The limitation only here is a network functionality and bandwidth availability. clinical teleradiology can also be used in interventional radiology procedures for sharing the expertise and the health education training. It also eliminates the radiation dose by continuous physical presence in the cath lab, which have very high radiation dose within the cath lab. It also minimizes the travel cost. Here you can see the workflow, the cath lab, operating room, the images acquired from here and then transmitted to the network for the sharing of the expertise and for the e-learning in synchronous and asynchronous mode. Synchronous when we are doing it real time at the same time when the operation is going on or procedure is going on. In asynchronous mode, you can store the data and retrieve them later for study purpose. Telemedicine can also be used for the dental implantology. In dental digital images from imaging modalities can be transferred without any loss of information to remote experts for surgical intervention or pre-operative planning. It can be also used for continuous medical training and education. Here you can see the pre-operative planning in dental implantation, the CT images acquired at other place and all the reformatted and all the volume rendered data sent through the data to the remote expert for the pre-planning. Robotized tele-echocardiography. Echocardiography is again a very highly specialized imaging for the heart, and the patient care, patient who require very specialized care in remote areas and where the access is not possible. So in these locations, we can use the robotized tele-echocardiography. Tele-echocardiography has three main parts: the master station or expert station, slave station or patient station, and the communication link. This is the workflow showing the robotic echocardiography. Here the slave station with paramedical staff, patient and the robotic system which acquire the images and send through the net to the master station for the medical expert opinion. This is the Otello robot which acquire the images of echocardiography and send data to the master station. Now, teleradiology can also be used for managing the gynecological and obstetrical, radiological and clinical data, which can be acquired and stored and processed in the hospital PAC system, and then these all data can be sent to the external physician for the expertise opinion if required. It also includes the mammographic image processing and evaluation. The telemammography. As we all know, the breast cancer is very prevalent in all over the world, and the women, most population in the remote areas is very high. So waiting time for the mammography is very long. So mammograms require special. Mammograms also require special expertise, which are very rare in the rural areas and the remote areas. The high resolution is must for minute lesions, so cannot compress the images, and therefore high speed transmission lines are needed. High volume teleradiology service also needs to focus attention on the radiologist and patient satisfaction. The factors that contribute to dissatisfaction of the radiologist are the poor image quality, not having a clinical history, not having enough images, spending long hours viewing the very large image data sets on computer, which can cause the visual fatigue or computer vision syndrome. The factors that contribute to improve image quality are increase the display luminance, use of a P45 phosphor cathode ray tube, and the perceptually linearized display. The global for the global market of teleradiology, there are two separate models. The Nighthawk model, which relocate the fully licensed domestic radiologists for the other country. The advantage of compliance with the existing license system, and the hospital doing business with Nighthawk do not need to fear being sued for negligence. And the disadvantages are the relocating the domestic radiologists and causing the shortage of the labor in the home market. This is also not very price competitive. The Indian model can provide unlicensed indigenous radiologists willing to work for 1/10 the wages of the radiologists getting in the developed countries, low cost. But for the fear of this market, the American College of Radiology lobbying for the market protection to protect the teleradiology market. This is the teleradiology workflow, which starts from the referring physician who refers the patient, then the modality to form the investigation or CT, whatever investigation required, then the central data center and the workflow coordinator, which sends data to the radiologist. Radiologist then interprets and reports the data and sends the report to the referring doctor again. The key drivers for teleradiology are scarcity of the quality radiologists in smaller cities. Remote diagnostic centers want quality reporting to increase revenues, reduce time and cost of traveling, and to increase the healthcare penetration a remote area. As Mr. Gupta said, this is teleradiology is still in the pilot phase or early phase, but I hope there will be a good scope for the teleradiology, particularly in the remote areas,